Hello and good morning. My name is Dr. Romina, and I'm here to talk to you about what you need to know about sciatic problem. So let's start today with who I am. My name is Dr. Romina. I'm a chiropractor. I've been in practice for over 25 years. And I wanted to sum up all this information for you because what I teach my patients in the clinic, I thought it would be great to share with you. Hopefully you'll have some benefits. Make sure that you fill out the survey that's attached to this link. That way you can find out exactly where your health, your physical health and well-being stands, all right? So my clinic is in West LA and you're more than welcome to join me. So what is sciatica? Sciatica is the pain that radiates along the pathway of the sciatic nerve. And it starts from your, it's an accumulation of the nerves that are coming from your spine, and they run through your buttocks, and they run all the way down to your feet. So sciatic nerve is the pathway of the actual nerve. The nerve itself is called sciatic nerve. And then most people relate sciatica to the actual accumulation of symptoms that is caused by this nerve. So when you have pressure on the nerve, it causes pinching and affects the pathway of that nerve. And here we go. Great. So it typically affects one side of the body compared to the other. And next one. Okay, now here's a misconception about sciatica, that the term describes the symptom. It doesn't. Sciatica is just a terminology for the pressure for the nerve pathway itself, whether it stems from a disc problem, whether it stems from a muscle problem or a joint problem or nerve pinch. So we'll discuss all that in detail with you today. So what causes sciatic pain? It's usually the disc bulges in the lower back or tight muscles in the buttocks region. It could also be the result of something called scoliosis or spinal degeneration or traumatic injuries, which one of them is finding an antalgic position, let's say after a car accident or after prolonged driving, prolonged sitting, you could actually get sciatic pain. And I'll tell you why or how this happens. So there's two basic types of sciatic problem, right? There's a sciatic problem that's neurologic in foundation, and there's a sciatic problem that is biomechanic in foundation. The neurologic aspect of it really stems from this lower back area and affects the nerve and shoots down, right? It's an actual compression on the nerve root. The roots of the nerve start from your lower back. So if you take your hand and put it in your lower back right now, like just slightly above the two dimples in your back, that's where the whole L4, L5, S1 area, that's the foundation or the origination of the sciatic nerve. They come together, they exit out of these branches and they come together to accumulate into one big trunk where we call the sciatic root, right? And the amount of pressure on the nerve can cause feeling of neurological pain, such as numbness, tingling, pins and needles, hot and cold sensations, or even weak muscles. Then there's a biomechanical aspect of sciatic problem, which means that that pelvis is shifted, right? So that typically has more of a diffuse pain pattern, and it originates from the spine and the pelvis, and its referral pattern is more of a dull, achy sensation, but also can be sharp, but it's more of a muscular problem rather than numbness and tingling, which is more neurological, right? Okay, so the next aspect that I wanted to talk to you about, let's talk about the biomechanics of the sciatic nerve. The biomechanics of the sciatic nerve, we're talking bio is biology and mechanics means how things move. Since your sciatic nerve, this yellow thing down here in this picture, stems from the lower back, runs underneath the sacrum, accumulates together into that big sciatic nerve here. Well, if there's any physical changes to your bones in your lumbar spine, pelvis position, sacrum position, hip position, biomechanically, bio means biology and mechanics means how things work. So biomechanically, if things are altered, it's going to affect the joints, the muscles, the tendons, and the soft tissue, right? So one of the biggest muscles that are holding your pelvis together and holding the sacrum and the pelvis and lumbar all together is your gluteus muscle. Now, gluteus muscle, also known as your butt muscles, is divided into two parts. We call it gluteus maximus, which is this big one that covers the whole area. And then if you pull that out away, then underneath it, there's gluteus medius, which is right alongside the pathways of piriformis muscle, which you've probably heard piriformis syndrome. And they all attach to the top of your hip. So if you take your hand and put it on your side pocket, that bony prominence that you could feel underneath your fingers, that's the tip of your hip area. If you take your fingers and put it under your buttocks right now as you're sitting, and you see that bone that's feeling under your fingers, that is right here. That's called your ischium. It's part of the pelvis area where the hip attaches to the pelvis, right? So any of these muscular structures can affect the pressure on the sciatic nerve. And when you get trigger points in those areas, it will by itself cause symptoms or similar feeling of sciatic problem. But it's mostly the dull, achy, diffuse pain. If you have trigger points in your gluteus medius, which is right around here, you get like kind of like a diffuse pain. The higher area of the trigger points area, you get more of a side pain. If it's exactly to the edge of this area, you get more of a sacral pain pattern. And if it's more along the most area, middle part of your buttocks, don't be surprised if you get pain sitting while sitting, or it's kind of radiating diffuse pain along the back of your leg and your thighs and your calves, all right? Side pain is typically gluteus medius as well as your TFL. So for the runners out there who have a desk job, don't be surprised having problem with running, maybe because of prolonged sitting, could be a mechanical problem. But we'll go into detail later. Let's talk about the piriformis muscle, which is a big indicator of where the nerve is being pinched. So the area that's being pinched is right around here. That's your piriformis muscle. If you're wearing heavy wallets on one side, if you're sitting with your legs crossed more often than the other, you're really looking at your piriformis problem. So right now, this slide and the previous slide is about muscular imbalance. And that pathways are the areas that are being affected. And now I want to talk to you about, what about the actual sacrum and the pelvis, where they connect together? Right around here. What about the two dimples in your back? That area is where the sacrum meets with the pelvis, and it causes a little dipping. That's why you get those two dimples in your back. It's right shown over here. So what about if the position of those skeletal areas, the joint is affected? This is sacroiliac joint problem. We call it sacroiliitis. It's typically right around the sacrum area. It's very evident on an x-ray, and if you have sciatic problem, I'd highly recommend you take an x-ray, because then you can identify if it's a muscular problem versus a skeletal issue, right? And obviously, if the problems don't resolve with therapy and treatment, you definitely want to take an MRI to see if there is a disc issue, which is more of a problem. Like on the hierarchy of importance, disc is a highly important factor, right? But we work our way through, and we kind of go through a process of elimination when you're in the clinic. But by yourself, check your posture and your pelvis position. Look to see if your pants, the zipper starts shifting to one side. If one side of your shoe wears more than the other side. If your pants typically sit, or your dress or your skirt typically sits lopsided on your body. Sacroiliac problems is really easily taken care of by chiropractor, whereas more of your piriformis and your gluteus trigger point therapy is treated by massage therapists and physical therapists, stretch labs that you can go to, but you could get all of those with a chiropractic clinic or a physical rehab or integrated practice. But the difference between sciatic, because of the musculoskeletal problem with gluteus muscle or piriformis, or the SI joint problem, is that you actually get a frontal pain when you have a sacroiliac problem. You get a pain in your groin area. So if you right now take your fingers and touch in your groin area, right around here. If you feel more sensitive, especially if you're laying flat on the floor or on the bed and you palpate, you touch you kind of feel the area of your inguinal ligament. And if it's tender on one side more than the other, you may be suffering from sacroiliac problem along with these other syndrome. And we call it a syndrome because it's an accumulation of symptoms. It's not just one thing that creates the diagnosis. It's a multiple accumulation of these problems, okay? So very important to check, to get this checked. It starts with just doing a posture evaluation. Let's talk about neurological. So we talked about the biomechanical problem, and let's talk about the neurological, the numbness, the tingling, the burning sensation. You see, sciatic is usually caused by a bulging disc in your lower back. And the levels that are affected are L4, L5, which is lumbar 4, lumbar 5, and the sacroiliac problem, which we call S1, which is the first part of your sacrum. It's also the transition of the curve from lower back going this way and sacrum going the other way. That transition is the area that gets most amount of pressure. So for those of you who sit and slouch, well, first thing, don't. Second thing, if you are having lower back pain, that is really a sacroiliac problem, not as much the upper lumbar issue. And if you're experiencing pressure on the nerves due to a disc bulge, a typical pattern identifies where you're having that level of problem. So if you have a very specific, drawn out numbness and tingling, paresthesia, or problems there, this is going to be the area. So if you're having it down your leg into your little toes, that would definitely be your S1 problem down here. That's where you're getting pinching. If you're having it more on your big toe, that's like L5. And if you're more having it on the side of your leg and side of your calf, that's more L4 area that you definitely want to be addressing. Now, typical pathway of the pain distribution is very typical. It's very drawn out. It's mapped out, so you don't have to, you actually can see where the problem is, right? You could identify it, and then immediately, and immediately what you can do is take an MRI and identify and know exactly what the problem is. And then, now that we talked about the problem, we identified it could be biomechanical or neurological. Let me give you some solutions and health hacks that I give my patients. So the solution and health hack we're looking at is sitting, especially because of the situation of working from home is the most common, or if you drive a lot, you want to make sure that, are you typically sitting on your wallet? Or if you're a female, do you tend to cross your legs when you're working? And you definitely want to interrupt those patterns. If you're wearing your wallet in the front, in the back of your back pocket, either switch it to the other side or just don't wear it and put it on your desk or in the drawer or in the front pocket. If you're a lady that tends to cross her leg habitually, one side more than the other, be cognizant of that. Know that you're putting more pressure on one side of your buttocks, which is protecting your sciatic nerve, and it could cause more problem. Okay? So definitely make sure that you take care of your proper body position, all right? Okay. Now, the next one that I wanted to talk to you about is standing. If you have a sit-stand desk, it's very important to have good posture. So check the alignment. I want to show you right here. You see that green circle over there? That's your earlobe. It should be in alignment with your shoulder, which should be in alignment with your side of your hip. And those 3 points should make a 90-degree angle between your buttocks and your knee joint, and make another 90-degree angle between your knee and your side of your ankle. This is the 90-90-90 rule that we apply into proper sitting position. If you tend to have more of an ergonomic, funky ergonomic seats, that gives you an angle between your hip and your thigh. Again, you want to make sure your upper torso is upright, because for every 1 inch that your earlobe is in front of your body, you're causing about 10 pounds of pressure on your upper back and 3 times more in your lower back. So if you are a dental hygienist, a dentist, an accountant, attorney, a blogger, a programmer, developer, if you have a job that requires prolonged sitting, slouching would be causing about 300% increase in your lumbar spine disc. So don't be surprised that all of a sudden your back goes out and you don't know where it came from. Well, it came from micro trauma over a long period of time. So changing, using a gym ball, using a stool. My favorite chair is a HAG chair. It's H-A-G. I think it's from the Scandinavian countries. And it is the best chair you could ever get for to be ergonomically savvy. That's my favorite. That's what I use after checking all the other chairs. And if you're standing, please stand in the morning and sit in the afternoon. Reason being is prolonged standing can affect your veins and the blood circulation, which develops varicose veins, and it also can affect and put too much pressure on the pelvis position. Or put something underneath your feet that elevates one leg versus the other. So be cognizant and watch my previous webinars on proper ergonomics. I've gone into detail with those. Now, seated or laying down stretches would be very effective. If you're sitting, crossing your leg and stretching your buttocks, gluteus muscle, anything that's got to do with your lower back, gluteus muscle and quadricep muscle is going to help you with the stretches, all right? Anything that's got to do with piriformis, you can do some side clams. It basically opens and closes the SI joint or the sacroiliac joint, and it allows the muscles to exercise on the posterior muscles, anterior muscles, internal and external. So it's going to be very effective and very helpful. All right. Seated stretches, whenever you get a chance, do those stretches. It's going to be very helpful. Performing yoga is immensely, immensely important because not only it physiologically allows your body to stretch and be healthy, but it also mentally gets you to a point that you can breathe better. And when you breathe correctly, you actually enhance your energy levels. So you definitely want to practice yoga if it's just watching it on YouTube at home. There are options of lumbosacral supports. So you can get your doctor to prescribe one for you. We call this LSO brace. This one is not prescription. You can buy it over the counter, but make sure you stay active. The more active you are is what helps the muscle. Most of these braces holds you up so tight that it's kind of hard to work with. Now, you could use trigger point therapies. I put together this little kit that you could use for health and posture, but you could easily use those. You can go on our website at Think Healthy and get what you need, or just get the spiky balls. I like the spiky balls. You're addressing a bigger, muscular, a fuller part of your body rather than an arm or an upper neck area. So therefore, these balls are specifically to get rid of those trigger points that are in your gluteus muscle, gluteus medius, TFL area. So it will definitely give you help. If by any chance your sciatica is from your lower back, you get more symptoms in your upper back as well. So if you feel pain in the upper back, sacrum, and the lower buttocks and legs, you might be suffering more of a lumbar and sacroiliac issue rather than sacroiliac piriformis problem. So check it out, get checked, it's important. All right, ice and heat, which one do you do which, when, which, how? Okay, let's start. If you have an acute problem, like you fall, you injure yourself, ice causes vasoconstriction, which means it reduces swelling, reduces inflammation by reducing the blood flow. The problem with if you use ice more than 20 minutes, it creates a reverse action and it causes vasodilation. Vaso means vascular tubes where the blood flows, right? So, and it's the muscles that are contracting the veins and the arteries. If you want to use heat is fantastic after 48 hours post-trauma. Heat is also very effective when you're having more of a chronic problem. Why do you want to use heat? Is because you want to relax the muscles. We're not talking about swelling and inflammation as much as we're really trying to reduce the muscle spasm, muscle tightness, muscle guarding. And then if you follow a stretch program that was mentioned previously here, after heat, phenomenal results, phenomenal. So definitely do that, okay? All right. Now, an ounce of prevention is better than a pound of cure. Correcting your posture is the #1 factor that you definitely want to do. So I personally wear a BAX-U posture support at all times. It's thin, it's very thin, it's adjustable, so I could make it tighter, I could make it looser, and I could make my posture much stronger and much more secure and stable, or I could just have it a little bit more easier. It's adjustable, and that's what I like about it. And what else I like about it is it's very thin. And what makes it uniquely different than other products, it doesn't compress the armpit. So you're not creating more carpal tunnel, numbness and tingling, weakness in your hands just because you have the wrong product on, not knowingly, but it was cheap. So you buy these cheap products, it causes more damage. Don't waste your time, don't waste your money. You'll end up paying a lot more for medical visits. So here we go. You remember that green circle I told you about? It's right here. That's your earlobe. And that little circle is the shoulder. They should be in alignment. For every 1 inch that your head is more forward compared to your shoulder, a correct position shoulder, not a rounded shoulder, there's an extra 10 pounds of pressure here and 3 times more down there in your lower back. The problem is when this is prolonged, have become habitual, and you habitually have a bad posture, you're actually setting yourself up for degenerative arthritis, which is the #1 cause. Once it's happened, it's happened. It's more like having cavities. You don't wake up with cavities. You don't wake up with a pinch or a root canal problem. You work your way through it. So don't work your way through it. Don't wake up to this problem. It's going to cost you a lot of time. It's going to cost you a lot of money. So prevention is the cheapest and the most effective. So get a BAX-U posture support. There you go. And change your workplace. All right. And we're going to keep going into it because this problem, just forward head position, will alter your pelvis and your lower back, which can affect causing problems with low back symptoms. So again, I like BAX-U posture support. I recommend it because comparing to other products, it does not compress your armpit and gives you shoulder freedom. So you could go to the website and purchase that, or you could go to the Think Healthy website, whichever you like. Now, sleep is a huge factor. And so you want to make sure if you are a side sleeper, please put a pillow in between your knees so you can reduce the pressure from your lower back. This mechanically helps you. And if you are suffering from symptoms, definitely ice the area, ice your lower back in this position. So lay on the ice pack, put a pillow underneath your feet, and make sure that your back is secure. Okay, this relaxes the muscles and the ice reduces the swelling and inflammation if you typically wake up with pain. Or change your bed because maybe your bed is causing you back pain. If you tend to have more of a lower back problem, put the pillow underneath your calves. If you tend to have more of an upper back problem, like around the bra line for ladies or around a little bit above your low back curve, you want to put the pillows underneath your thighs. If you, this is typically a posture of anxiety. So if you tend to be curling in, that's not going to help you at all. Laying on your back and just breathing into your into the center of your body, also known as your chakras, is going to be very effective in calming down the anxiety. So hopefully that was helpful, but that's a whole different webinar. Now, what kind of a pillow do you use? Speaking of sleep, there's 2 types of pillows. There's the pillows that feel good. It's like how you feel, whether it's down, whether it's foam, whether it's memory, whether it's hybrid of both, whether it's feather. That's how you feel. It's your preference. And there's a functional aspect to your pillow. Is it working for me while I'm sleeping? Am I helping my health and my body? My favorites are 2, 3, 4, and 6, because this group of pillows functionally help promote better posture, and they support your neck and your upper back. The other two pillows tend to cause your forward head position. So that's why I prefer functionality. These are the styles that you want to use. What I'm using personally is number 6 and number 2, and I use them interchangeably depending on what I like. And this part is the type that you want to choose. Okay, what do I like? That's what matters. So if you visit our website, you notice that I put together these little kits. These are the same things that I recommend to my patients when they have problems. So if you have problem with your posture, you definitely want to get the posture kit. It comes with a posture brace. It comes with a resistive band that you strengthen the muscles that are weak. And it also comes with the massage balls that you can do trigger point therapy at home yourself. So highly recommended if you want to get it. It's a kit. Everything comes with it. You don't have to do much thinking. It's done for you, okay? And that's what I recommend to my patients. So the kits have specific products in there that I recommend it, and I've tested it with my patient. It's effective, it's very travel friendly, and it's very compact. So you could use it whether you're at home or visiting a friend or traveling. My name is Dr. Romina. I hope this was helpful. I hope this was effective. My goal is to bring you better health at the comfort of your home. My goal is to help you, give you home health hacks. And if by any chance you need me, you're more than welcome to contact me. I do take telemedicine appointments, and we have a link for you, so please use that link. I want to thank you for your time, and send your messages and send your emails to us. We're here to help you. You can reach me at info@BAX-U.com, or you can reach me at drromina@thinkhealthy.com. Thank you and have a wonderful day.